The Radiology Advisor is a small button that floats on top of the organization's EMR and monitors the quality of care provided to the patient in real time. The advisor reads all patient information from both the EMR and all the other ancillary systems at the organization that hold patient information, including lab results, pharmacy, radiology, and physician's dictations. And yes, for its accurate performance, beyond just collecting information entered into the EMR's structured fields, the advisor also reads the free text notes that are entered by physicians and nurses to the EMR and notes dictated to the organization's dictation system. The advisor's capability to read free text notes as well as structured data makes it a very accurate data agent that collects all patient information, regardless of where it's entered and in what format, structured or unstructured, making it an effective tool that keeps a comprehensive snapshot of the patient's data at any given moment. So what does the advisor do with this data? The Radiology Advisor is loaded with radiology best practice protocols and rules, focusing on reducing and controlling overutilization in imaging management based on CMS guidelines. These best practices can be fully customized to represent the organization's unique approach to clinical practice and workflow in radiology management, so the advisor should be well tuned to work according to your daily workflow with your patients and documentation. The role of the advisor is to continuously monitor the care delivery and documentation quality for each patient that falls into the radiology protocol, and identify any deviations or deficiencies in the care provided, in real time. Once a deficiency is identified, the advisor prompts the clinical staff to make them aware of such deficiencies and to assist in providing the best care, anytime. So let's see how it works. The advisor floats on the organization's EMR and can be easily positioned on the screen wherever you like. The advisor's basic steady state status is OK, green, indicating that there's no deficiency in the approach to the patient, with all aspects that relate to compliance with the radiology guidelines as indicated by the government and the organization. However, once it identifies a deficiency in care, the advisor immediately responds. In this case, the user is documenting in the hospital EMR that the patient was just admitted with severe headache for the past 6 hours. The advisor reads the free text notes, and upon clicking the Submit button in the hospital EMR, the advisor, in a few milliseconds, starts flashing Important. This means that the advisor just identified a deviation from the expected care or documentation that requires the attention of the clinician. Clicking on the flashing advisor presents what the missing item is. The patient has severe acute headache and documentation of emergent etiology symptoms of headache is missing. Clicking on the prompt itself presents the explanation for this deficiency. Patient has acute headache and emergent etiology symptoms must be evaluated. The advisor is there in real time to make sure the right approach and documentation are provided. The advisor will read everything documented in the chart in both a structured or unstructured manner. In this case, documentation in free text that this is the worst headache of life will be immediately captured by the advisor, which will present with the appropriate guidance, non-contrast head CT. Clicking on the prompt will present the explanation. Patient has complaints of headache with symptoms suggesting an emergent etiology. A non-contrast head CT is indicated. Placing an order for a non-contrast head CT will be captured immediately by the advisor and the prompt will go away, turning the advisor back to OK. However, the advisor will not fall asleep. It will keep monitoring the correctness of the imaging decisions and actions taken at any given moment. In this case, another physician documents in the chart that the patient had similar headache in the past. The advisor immediately responds, indicating that a reason for not canceling a CT exam is missing. The patient gave new information, denying complaints of headache that require a CT exam. A reason for not canceling the CT exam should be documented. Canceling the CT will turn the advisor to OK again. Now, let's rewind back to the point where the advisor prompted for a non-contrast head CT due to worst headache of life, and the physician correctly orders a non-contrast head CT. The advisor turns to OK. However, as often occurs in a busy ER unit, critical CT exams get dangerously delayed, but the advisor is there to make sure the dots are kept connected. After 45 minutes with no progress, the advisor starts prompting again, indicating that the non-contrast head CT is still missing and that the patient has emergent etiology symptoms of headache. A CT examination was ordered more than 45 minutes ago but has not been performed yet. In addition to the advisor button at the bedside level, the application also has a central monitor, which can be located at the central nurses station, a physician lounge, or any other central monitoring location. The central monitor is used to escalate the prompting to a central location, to allow activation of the chain of command if a deficiency becomes critical and is not dealt with at the bedside level within the expected time frame. An additional 15 minutes pass, and now the delay in performing the CT is more than an hour. At this stage, the advisor starts flashing orange, indicating that the status of the delay is now critical. This alert also escalates to the central monitor, which starts flashing orange by the patient's name. Clicking on it reveals the reason for this alert. Documentation in the chart that the CT was performed turns the advisor to OK. Since no major findings were identified by the CT, the physician proceeds forward to ordering an MRI. But the advisor immediately starts flashing, indicating that a reason for performing an MRI is missing. Both CT and LP should be performed in this situation prior to performing an MRI. A reason for an MRI should be documented. Since indeed an LP is indicated first, the MRI is canceled and the advisor turns back to OK again. If the LP is performed and documented as inconclusive, the advisor will then prompt for the MRI. Due to no findings in the CT and an inconclusive LP, ordering an MRI will turn the advisor back to OK.